Hi, my name is Larissa Donald, and I'm part of the ITPC Citizen Science Project team. Thank you for the opportunity to share a little bit about our project. ITPC has been championing community-led monitoring and advocacy for several years, and citizen science is our latest attempt to track COVID-19's impact on health services for people living with HIV and TB using this methodology. While we didn't focus only on young women and girls, we did include several youth activists, and this presentation highlights some of their contributions. Citizen Science is an initiative of ITPC that moves from models of data extraction to data democracy by combining community-led interventions, including community-led monitoring, implementation science, and a novel methodology that we've called life mapping, which uses collaborative and participatory visual media tools to effect advocacy. It acknowledges the people are the experts in their own lives and that we don't necessarily need to paraphrase them. We can allow them to develop their own solutions and simply support that process. It pivots away from the notion that academic research and analysis are the only legitimate knowledge creation methods. By combining community-led monitoring, qualitative and quantitative data collection and analysis at health facilities with operational research, and then using life maps to triangulate outcomes, this methodology provides real-world data at scale while retaining the ability to generate granular data that elevates the voices of recipients of care. And this has been particularly valuable during COVID when traditional research methods haven't really been that practical. It may be useful just to take a step back and talk about what community-led monitoring and advocacy is in this context. Community-led monitoring is a process where communities take the lead to routinely monitor an issue that matters to them by identifying their top priorities, creating indicators to routinely track those priorities, collecting data, analyzing the results, and sharing insights from the data with a larger group of stakeholders. Communities then work alongside policymakers to co-create solutions to problems they have identified. When problems are uncovered through CLM aren't resolved, communities can escalate using evidence-based advocacy and campaigning until they achieve implementation of corrective actions by duty bearers. And it allows them to push back against the idea that, well, what evidence do you have of what you're saying? So it upskills and provides the tools that are required to actively make change and effectively engage with policymakers. Now let's move on to what life maps are and why they're different from traditional qualitative and quantitative research. Life maps is a methodology that uses collaborative and participatory visual media tools to document the experiences of recipients of care. In other words, people that are going to public healthcare facilities to access healthcare. It collects data that is not already in the traditional healthcare system, so it moves beyond the statistics of how many doses of a particular medication have been issued, for instance. Outcomes of the project reflect the experiences of the participants, their advocacy pathways and priorities, and real-world changes, such as improved oversight of healthcare, greater gender and sexuality empowerment, and greater family and social support. I'm now going to move on to some examples of what was submitted by participants using mobile phones, which we gave them to collect data in the field and to document their lives. Here's a snapshot of some of the data that was submitted. And first, I'm going to play you a little clip that was submitted by one of our participants talking about how COVID has impacted mental health.
First of all, there's a lot of stress that is caused by COVID-19 and the impact that it has on my day-to-day life. Like now I have to rely on no contact visits, no contact classes, no contact whatsoever, basically. So
in addition to tracking traditional health-related issues like medication, stockouts, what we tried to do with life mapping is take a look at all the other things that might impact a lack of access to healthcare services, and medical issues are often compounded by mental health issues, and also things like food security and access to transport to healthcare facilities, which has been severely impacted by COVID. We're now going to move on to something that one of the other participants shared, talking about how COVID has impacted specifically access to HIV prevention services.
So in terms of the COVID impact on human immunodeficiency virus, I think what has happened is that in terms of testing, what I've seen is that they have prioritized promoting COVID testing. COVID has been one of the things that they prioritize, and when it comes to HIV testing, you don't get those mobile clinics or those tents anymore. Most of them, they focus on COVID testing, and you might find that once in a week, and then you get those is it Qelimpilo or Znempilo tents that do HIV testing. But other than that, it's been COVID and nothing else but COVID. And access to contraceptives or condoms, I think I haven't seen them promoting them anymore. Not that they're not, but a lot. It used to be in our faces, particularly in shopping complexes. You would get your prep buses, or you would get your dreams buses that would visit malls. But these days, it's not that case anymore. When you visit the mall, or when you go to the police station, or when you go to the shopping center, you'd find only people that deal with COVID, and it's like HIV, it's non-existent anymore. So, and also accessibility to PrEP. I think I've sent also one of the interviews that I had with one of the three of girls that were mentioning that they are no longer giving them contraceptives. They are no longer allowing people to go inside the clinic. People are not getting any medications, stuff like that.
So just reflecting on something that Paula Mondieri mentioned during the opening of the session, nearly 250,000 young women have contracted HIV during the last year, the year that was severely impacted by the COVID pandemic. And the explanation shared by Starfire about the context of HIV prevention services and the state of them, and how they've been negatively impacted by the pivot of healthcare services to COVID, really helps us to explain why new infections continue. Thank you very much again for the opportunity to share this methodology, and I hope that by sharing some of these examples, you get a sense of the power of the methodology, and maybe you can find ways to incorporate it into the work that you're doing.
Community-led monitoring for young women. Community-led monitoring is an accountability mechanism for HIV responses at different levels, where communities take the lead to monitor an issue that affects them by identifying their priorities, creating indicators to track those priorities, collecting data, analyzing the results, and sharing insights from the data with a larger group of stakeholders. Communities then will work alongside the policymakers to co-create solutions to the problems that they have identified. Community-led monitoring also creates a structured, supported, meaningful, and accountable process so that people who receive and benefit from healthcare services have a seat at the table and a voice in the planning, implementation, monitoring, and evaluation of those services of which they benefit from. Communities have already been very active in ensuring accessibility, availability, and acceptability of health services since the beginning of the HIV epidemic. However, there exist some challenges which act as a huge barrier to this agenda, and especially for women and girls. A lot of women in communities may find it very difficult to sustain participation as a result of gender barriers, which is a major challenge that hinders the meaningful participation of women in community-led monitoring. And most often, time and cost are challenges that are very much associated with monitoring of activities, as women and girls in rural communities are not empowered to support themselves and are tasked to look after the home setting and not the community. And oftentimes, communities are not organized enough, and thus the capacity to allow for effective monitoring is usually very minimal or inefficient. Some of the lessons we learned from the implementation of community-led monitoring and community-led responses are: it's very important to build trust between all of the groups of people who are involved. That's including the government, service providers, community groups, and sponsors. Involving all of these groups of people is a critical factor for the success of community-led monitoring. And when communities themselves drive the agenda and operate without external influence, they can better connect to the work and have access to decision-making authority, and thus the response tends to be more effective. Moreover, when women and girls are involved in community-led monitoring, they are oftentimes the first to detect and diagnose problems and challenges because they are most affected, and community-led monitoring gives them the opportunity and the capacity to share what they know with the decision makers and to fight to ensure that their needs and rights are met. In conclusion, the meaningful involvement of women and girls in monitoring their health systems is essential as they can better connect to the work, provide insights and knowledge that are unavailable to the external factors, and they can provide better feedback on the acceptability of solutions to resolve issues that affect them. Community-led monitoring also provides opportunities for young women and girls who are members of a community to influence decision-making processes that will translate into action and meaningful evidence change. Therefore, addressing the challenges in the quality of and access to services in the HIV response cannot be done successfully without involving women and girls in community-led monitoring. Thank you so much.
Hi, everyone. Nyasha Fanisis Tole from Athena Network. I'm going to be talking about the work we've been doing as Athena Network, engaging young women and girls using social media. So as Athena Network, as you can see from this beautiful presentation, we're a global organization with a focus for Africa and HIV feminists, SRI, HRI, and youth intersectionality. And one of our flagship projects that I'm going to talk about is the What Girls Want campaign, which is also led by 10 phenomenal young women leaders from across 10 countries in Eastern and Southern Africa. And we're very grateful for the partnership that we've had with these young women because they have been at the forefront of co-creating, deep diving with us and being able to navigate on how we can continue to engage adolescent girls and young women, especially when we're hit by the COVID-19 pandemic, where we had challenges with face-to-face meetings, face-to-face integrations that we're used to. So that's the work we've been doing. So you can see that with the What Goes One campaign. So this is what I can try to summarize very quickly on how we manage to engage adolescent girls and young women using social media. So you can see that we call this conquering the gendered digital divide, because as we know that when COVID-19 hit us, we were forced, or we're actually supposed to change the way we're doing things and try to adapt to COVID-19, but at the same time ensuring that the spaces that adolescent girls and young women engage do not get closed up, they keep to be open. And how did we do this? We engaged in capacity strengthening on digital advocates for adolescent girls and young women, and this we did via WhatsApp groups, setting up WhatsApp groups that were led by the 10 focal points that I initially mentioned. And in these WhatsApp groups, what we also did with as Athena was to ensure that we are providing young women with resources and information to understand what is digital advocates, how to navigate digital advocates, and even how to stay safe online. This was really paramount as we talked about strengthening on digital advocates. The other thing that we did was to provide resources, including data stipends. This wasn't a very easy thing because most of our funding partners and donors, we had budget line items prior to COVID-19 on travel, to engage in conferences, advocate spaces, and meetings. But then with COVID-19, we had to really think through and say, okay, how do we continue supporting engagement in these spaces? And this included providing data stipends for young women. And sometimes it could not be much, but maybe a $50 data stipend, just to ensure that they're able to buy the data and are able to connect online for them to be able to engage in the advocate spaces. And then the other thing that we did, which is around strengthened and expanded existing platforms. So one good thing about the work that we did as Athena was engaging on social media wasn't really something that we started just when we were hit by COVID-19, but previously with a previous campaign that we initiated in 2016, What Women Want, we had already mastered the use of WhatsApp to engage adolescent girls and young women, knowing that it's low cost effective. On WhatsApp, you are even able to send documents, you can chat with people. Now the groups have been expanded to about 256 per person. And in most countries, we realize working in Eastern and Southern Africa, when it comes to data bundles, there are actually some specific data bundles on WhatsApp, which makes it easier to use WhatsApp as a platform. So it is very cost effective. So what we did now was look at, say, okay, we have the What Women Want platform, and we have learned that it can be effective and it can also help adolescent girls and young women to engage in advocacy online. So what we had to do was just to expand those spaces and ensure we have at least 10 WhatsApp groups across the 10 countries that we work in, and we are able to reach almost 2,560 adolescent girls and young women, because all those WhatsApp groups are currently on full capacity. And the role that, or the work that we do there, is to send opportunities for advocacy, is to send resources that young women can use for advocacy, and also to encourage peer-to-peer leadership and mentorship. So basically, this is how we navigated. So as you can see from these blobs, these are some of the experiences that were shared by the What Girls Want focal points as they led this work in the previous, or in this past year, on digital advocacy and engagement. And one of them that I think I can quickly read is the one that's coming maybe from South Africa, which said that the pandemic has forever changed life as we know it. However, it has effectively put digital advocates at the forefront for the work we do, and has proved to work tremendously. I've been able to use social media to reach masses of AGYW in South Africa in a short space of time, sharing information and capacitating one another. May we never cease to use social media platforms to get our messages across and to touch lives. So this is basically one of the ways that we did. We also had a couple of projects like the She Ready Dialogues, and with She Ready Dialogues, we're also using Zoom as a platform for engagement, to engage in dialogues, and also Instagram Live, which was also quite a new thing for us to explore Instagram Live and ensure we engage more young people across social media. And we did a Twitter campaign that would continue to use Twitter, understanding that we might not get instant responses from the people who want to target, but whenever you use Twitter and if they are active on Twitter, you are definitely able to get in touch with them and be able to pass across the message. So as we were engaging in this pandemic, and also as we're going to engage beyond the pandemic, we have really understood that another way to engage adolescent girls and young women is to use social media, as it is low cost effective, easily accessible. And of course, we are very cognizant that the gender digital divide still is in existence due to issues of structural digital platforms, access to internet. But we continue to do our best to ensure that whenever we have these spaces and we get to co-create them, we make sure that we are providing the necessary resources for girls and young women to engage. Thank you. I hope I've been on time.
Thank you, Nyasha. I mean, all that you and Larissa and Miranda have shared really has just been inspirational to listen to. So thank you so much for your on-the-ground innovative work in making sure that you continue to engage adolescent girls and young women throughout the pandemic.